Have you been feeling full too quickly after eating, even when your plate was small or half finished? Or maybe you've dropped a few pounds lately, but you're not dieting and your routine hasn't changed. Now, imagine this. Your body might be whispering warnings, and you're brushing them off as just part of aging. But what if they were the first clues of pancreatic cancer, one of the deadliest yet most silent diseases in the world? Today, I'll walk you through 7 early signs you should never ignore, especially if you're over 60. Because the truth is, pancreatic cancer rarely screams. It whispers softly until it's too late. But if you catch it early, you give yourself a real fighting chance. Quick question before we dive in. What's one weird symptom you've had recently, even if it seems small? And how old are you today? Leave a comment below. Your story could help someone else stay alert too. Let's begin with the most underestimated sign of all. Number 1, sudden loss of appetite. And why it's not just getting older. You've always enjoyed food, but lately nothing tastes right. Meals feel like a chore. You eat half a sandwich and push the plate away. Sound familiar? This shift might feel emotional, but it can be physical. When the pancreas is inflamed or under stress, it disrupts hormones like ghrelin and leptin, which control hunger and satiety. That means your body may be struggling internally, even if your mind hasn't caught up yet. If this happens for more than a week, don't chalk it up to just age. Pay attention, some seniors say. I used to crave breakfast. Now I forget to eat until afternoon. That's not normal. That's a signal. Number 2, dark urine and pale stools. Your bathroom might be your best early warning system. Let's talk bathroom signs. If your urine suddenly turns darker, like tea or cola, and your stool becomes light, gray, or even clear, it's time to take it seriously. This often means bile isn't flowing right, and one common cause: a tumor pressing on the bile duct. Some people also notice greasy stools that float or smell unusually strong. That's a sign fat isn't being digested properly. If this happens for more than a few days, even if there's no pain, it's worth getting checked because your liver and pancreas are linked. And sometimes, the bathroom holds answers your doctor hasn't even looked for yet. Number 3, unexplained. Itching. When your skin is trying to speak for your pancreas, not all itches are from dryness or allergies. Some seniors say it felt like ants under my skin, but there was no rash. This can be a reaction to bilirubin building up in your blood, a result of bile backup linked to pancreatic blockage. It may start subtly, the arms, the back, or the chest. Lotions won't help. Antihistamines do nothing. It's internal, not dermatological. This kind of itch often appears weeks or months before other symptoms. So if your skin's itching for no clear reason, your pancreas may be the source, not your skin. Number 4, new diabetes after 60. A hidden message, not just a diagnosis. Let's break a myth. Diabetes isn't always about sugar. Sometimes it's about cancer. In fact, 25% of pancreatic cancer patients are diagnosed with type 2 diabetes just months before their cancer diagnosis. So why? Because the pancreas also controls insulin, the hormone that regulates blood sugar. When cancer interferes, your glucose levels start acting up, even if you're eating well and walking daily. If you've never had blood sugar problems, and suddenly you're told you're diabetic, that's not just bad luck. That's a red flag, especially if it's combined with any of the other symptoms we've mentioned. The next symptoms are even more confusing because they mimic normal aging pains, but they could mean something far more serious. Let's keep going because the next symptoms are even easier to miss. They're subtle, quiet, and often blamed on just getting older, but they can be early warnings from your pancreas. Let's look at number 5. Number 5, mild back or stomach pain that comes and goes. Your posture may not be the problem. You've had this dull ache right in the middle of your back or under your ribs. Some days it's there, some days not. You stretch, you lie down, you take a warm shower. It helps a little, but it always comes back. Here's the truth. This pain might not be from your spine or digestion. It could be referred pain from the back of your pancreas, where many pancreatic tumors quietly develop. Because of how your nerves are wired, you feel it in your back, even though it starts deep in your abdomen. Pain that worsens after eating or lying down flat can be a key clue. So, if you've had mysterious mid-back discomfort for more than 2 weeks, it's time to speak up. Number 6, unintentional weight loss. Your body may be starving even when you're eating. Have your clothes started feeling looser? Has the scale dropped 5, 10, even 15 pounds without you trying? Many seniors might feel glad at first, but unexpected weight loss after 60 is never a good sign. The pancreas plays a key role in digestion. It helps your body break down fats and absorb nutrients when it's not working properly. You may eat the same meals, but absorb far less. You lose muscle, you lose fat, and over time, you lose strength. Some people say, I eat like I always did, but I'm shrinking. That's not aging, that's malabsorption. And your pancreas could be the missing link. Number 7, feeling bloated even after small meals. The digestive slowdown nobody talks about. You eat a little and feel like you had a feast. Your belly swells. You feel tight, full, maybe even a bit queasy. It happens with soup, with salad, with eggs, and you're left wondering, why do I feel like I overate when I barely ate anything? This could be a sign your pancreas isn't producing enough enzymes that help digest proteins, carbs, and fats. Without them, food sits in your stomach longer. It ferments, it inflames, it bloats. You might burp more, feel pressure in your upper belly, or even avoid eating altogether to escape the discomfort. This is not acid reflux, and it's not eating too fast. It's a warning that your digestive system is under stress, and your pancreas could be the one struggling now that you've seen all 7 early signs. One question remains. What should you do if you recognize 2 or more of these symptoms? That's what I'll explain in the next section, including a checklist you can take to your doctor, and a way to protect your pancreas starting this week. Don't miss it, because catching this early could truly save your life. If you recognize 2 or more of these symptoms, don't panic, but don't wait either. Pancreatic cancer is called the silent killer for a reason. By the time pain or weight loss shows up, it's often been growing quietly for months. But the good news is, early detection makes a real difference. According to Johns Hopkins Medicine, when found early, some forms of pancreatic cancer can be treated successfully, even in people over 70. So here's what you can do next. Take this simple checklist to your doctor if you're over 60. bring up any of the following: sudden loss of appetite, unexplained weight loss, itchy skin with no visible rash, dark urine, or light-colored stool, new diagnosis of type 2 diabetes, persistent bloating or digestion issues, mild back or abdominal pain. That won't go away. Even one of these can be a clue, 2 or more. That's enough to request deeper testing. Ask about a CT scan or blood markers for pancreatic function. You have every right to be thorough. How to protect your pancreas, starting this week while you talk to your doctor. You can also take small steps to reduce inflammation in your pancreas. Eat fewer processed carbs and sugars. These force the pancreas to overwork, especially with age. Add anti-inflammatory foods like turmeric, leafy greens, blueberries, and olive oil. They help protect your digestive organs without needing supplements. Limit alcohol, even in small doses. It can stress your pancreas. Watch out for hidden fats in fried foods, sausages, and ultra-processed snacks. Stay physically active. Even a 20-minute walk per day can support healthy insulin levels and reduce internal pressure on your pancreas. These habits won't cure cancer, but they create a healthier environment in your body, making it harder for disease to grow unnoticed. Your age is rising, but so can your awareness, strength, and power to act early. And maybe, just maybe, this video will help someone catch a dangerous disease in time. So here's your final mission. Leave a comment. Have you experienced any of these symptoms? Or do you know someone over 60 who should watch this? Share this video with a friend, sibling, or parent, even if they feel fine, especially if they're over 60. And don't forget to subscribe. We post weekly videos to help you live longer, stronger, and smarter without fear. Thank you for watching. Take care of your pancreas.